caption as well. Now, this Congress aims to provide a virtual platform for collaboration, knowledge exchange, networking, and innovation. It's bringing together researchers, clinicians, policymakers, patients, and advocates, all united by a common goal, which is to improve the lives of those who are affected by sickle cell disease and other inherited blood disorders. So, as we begin this year's Congress, let us be inspired by the progress we've made together so far, the partnerships that continue to strengthen our global community, and the opportunities ahead to advance equity, access, and excellence in care. Now, in this spirit, I would like to mention quickly one of the main programs of the GANSID, which is to advance, more universal clinical trial standards for inherited blood disorders globally. And to advance this work, the GANSID Clinical Trials Site Standardization Advisory Working Group did create a survey on barriers and obstacles experienced by sites in clinical trial participation. And while we have received a strong number of surveys completion from sites that are operating in low and medium income countries, we would love to receive more responses from high income countries. And this study has received Research Ethics Board approval from Canada. And your support in completing the survey if you're a clinician in a high resource country, and also sharing it with your colleagues will be very appreciated. I will be posting the link to the survey in the chat box very shortly. Please complete it. Now, before I introduce my co-chair of the Congress Planning Working Group, Dr. Leonard Valentino, I would like to officially thank the Congress Planning Working Group members and also to recognize the funders of this Congress, Vertex, Agios, Pfizer, Roche, Novartis. We thank you for your generous donations or contributions. And now I'm going to bring Dr. Leonard Valentino to bring the welcome address for the third International Congress on Sickle Cell and Other Inherited Blood Disorders. Dr. Valentino is a professor of pediatrics at Rush University Medical Center in Chicago, Illinois, USA. His professional goal is to improve the health and well-being of people with bleeding disorders globally through research, advocacy, and education. He himself, and Dr. Valentino and a few other people were part of a paper Dr. Valentino led, with the American Society of Hematology. So I'm very pleased to be working with Dr. Valentino on all fronts. He's an amazing fellow. And so please join me to welcome Dr. Leonard Valentino to bring the welcome address this morning. Thank you.
Thank you, Lanre, and good morning, good afternoon, good evening to everybody who's attending from around the globe. It's really exciting to be part of this third International Congress of the Global Action Network for Sickle Cell and Other Inherited Blood Disorders. Our theme this year, I think, is one that is very important, which is transforming care and strengthening communities. I think through the community, we have the opportunity to impact many people, and through those communities, we can then strengthen the care that people with sickle cell disease and other inherited blood disorders receive. The education that's provided to healthcare professionals, but more importantly to patients and advocacy groups is vital. So our Congress program, I think, is steeped with lots of learning opportunities for everybody. Our theme this year, as I said, is transforming care and strengthening communities. So I think that everybody will have opportunities to be able to engage and learn. We're going to begin with a opening keynote address by somebody who is extremely well respected, my colleague and friend, Dr. Keri Norris from the National Bleeding Disorders Foundation. We will have a number of plenary sessions To begin the days, our first plenary session will be the future of gene therapy for inherited blood disorders. And then we'll break into some simultaneous sessions where we'll have a clinician track and a community track. So you'll be able to choose which of those you would like to attend uh, uh, at first. But remember that all of this is going to be recorded, so you will have the opportunity to go back to listen to any of the sessions that you were not able to participate in directly. I think it's going to be very important as we talk more about both thalassemia and sickle cell disease throughout the morning. We'll talk about bleeding disorders. And then I think we're going to have a very exciting session on pyruvate kinase deficiency in terms of its diagnosis and management. Our second plenary of the day will be transforming care from pediatric to adult services in inherited blood disorders. And we've got excellent speakers for that as well. So I think it's going to be very exciting. We're going to end day one at about 12:15 Eastern time. And then tomorrow morning, we'll begin again at the same time. And we're going to begin with a plenary session on the comparison of guidelines for blood and blood product management across low, middle, and high income resource countries. I'm really looking forward to that presentation on a very important area. Then I think it'll be, again, we'll go into some simultaneous sessions. We'll have a clinician track as well as a community track throughout the morning tomorrow. And then we'll end with a final plenary session on advancing global registries in sickle cell disease. Another very important area to be able to create data-driven advocacy. After the break, we'll have some oral presentations of abstracts from several individuals. And then we'll have another plenary session on the Industry Alliance Symposium that will be focused on strategies for effective advocacy in advancing inherited blood disorders, regardless of where you live. And then finally, we'll have a sponsored symposium by Pfizer, and then our closing remarks for the day. So again, I'd like to echo all of the welcome that you've already heard. And I think you're in for a very exciting couple of mornings or afternoons or evenings, depending on where you are in the world. So with that, I would welcome you and look forward to seeing all of your comments and questions as we progress through these 2 days. Thank you.
Thank you, Dr. Valentino. Thank you very much. And so, for the next session, folks can remain on this platform, but you can take about 5 minutes to go grab your coffee, your tea, and we will be starting the next session at 7:30 promptly. So just take a few minutes and grab your tea and your coffee. Thank you. And you can come back to the same platform. Thank you very much.
Sam, are we ready to start?
We're just giving Dr. Keri a moment.
Good morning, Dr.
All right.
Sorry, Sam. Go ahead.
Okay. Thanks, Mr. Hines. Dr. Norris?
Yes.
Okay. Glad we finally got this sorted out with the technical difficulties. So
Yes.
in this situation, I will be advancing your slides. But before we get to that, let me introduce our moderator for this session, Mr. Hines. And I'm just going to pull up his bio here. Mr. Hines, he's known for his keen ability to foster relationships and strike partnerships to help realize equitable health outcomes. He is deeply committed to advancing health equity and is a strong champion for cardiovascular and cerebrovascular health and sickle cell anemia health initiatives. He's a board member for the Sickle Cell Awareness Group of Ontario, and his interest in advancing the equity of sickle cell disease care stems from his time supporting the ethical, social, and cultural ESC program for the Bill and Melinda Gates Foundation's Global Health and Global Development programs at St. Michael Hospital and the International Network for Evaluating Outcomes of Neonates at the Maternal Infant Care Research Center at Mount Sinai Hospital. So without further ado, I'll give this over to Mr. Hines, and you can read more about him on the website. Cheers.
Thank you, Mr. Tunji-Ajayi. You're far too kind. And good morning, folks, and welcome to our keynote for this year's third annual Congress delivered to you by GANSID. We're joined today by Dr. Keri L. Norris, who will be talking to you and delivering her keynote entitled Charting the Pathway to Health Equity for Inherited Blood Disorders. Her bio is full with accolades, and I won't be able to do it justice in this very brief introduction, but for those of you who want to take more time to learn more, as my colleague mentioned, please visit our Congress website where you can learn more about the speakers, including Dr. Norris and Dr. Valentino, who spoke earlier. So today, Dr. L. Norris is a seasoned public health professional with over 25 years of experience, including 17 years in executive leadership and administration. She currently serves as Senior Vice President of Health Access and Strategic Innovation at National Bleeding Disorders Foundation, where she champions the needs of individuals with bleeding disorders and rare diseases by designing culturally responsive programs and health equity frameworks to reduce disparities. She's a sought-after speaker, a consultant. We're very privileged to have her here joining us. And outside of her professional work, she also enjoys both reading, watching movies and TV series, and of course, spending quality time with her family and loved ones. So without further ado, I turn the virtual microphone over to you, Dr. Norris.
Thank you so much. What a wonderful introduction. And I'm so very happy to be here with everyone this morning. I'd like to acknowledge Lynn Valentino and the Congress overall for having me this morning. So if we can go ahead and start with my slides, if we can go to the second slide, please. Thank you. So today we are going to talk about charting the pathway to health equity for inherited blood diseases. And so we'll take a general look overall for what's going on in various areas, and then we'll meld it all together, look at those challenging areas, and then talk about how myself and my team, the Health Access and Strategic Innovation team at NBDF, have created this framework along with Dr. Valentino and others to chart the path moving forward, and then how it might apply to other inherited blood disorders and diseases. Next slide, please. Next slide. So I want to acknowledge all of the stakeholders that are currently in the room. Thank you for your work, your passion, your advocacy, and everything that you do for moving sickle cell and other inherited blood disorders forward, for getting that space, for getting the attention, for making sure that it doesn't fall to the wayside. So the first thing I want to say is when I first became a part of this community in 2021, I had people that I knew specifically who did not share with me that they had bleeding disorders or blood disorders until I became a member of what was then the National Hemophilia Foundation. And when I moved forward with working here and started becoming a passionate member of the community, I learned that there were many people who had not been diagnosed, right? Who had not had the opportunity to have those cultural interactions with their doctors, who had not had the opportunity because they lived hours away from a hemophilia treatment center or hours away from a hematologist that they could see. And so seeing that people had delayed diagnoses for various reasons, or they couldn't get their factor, or they couldn't get to hospitals quickly enough, to help them with things as getting diagnosed, having women who were pregnant, having birth, and giving birth with physicians who did not know a lot about hematology or bleeding disorders and the complications that arise from that. And so that set me out on a path to say, we have to do better. We must do better. And it started this kind of rolling ball of what I'd always been doing around health equity, but to focus it specifically on bleeding disorders and rare disease. Next slide, please. So what we're talking about right now is the why. So we all know what brings us here and what makes us passionate about certain areas in our lives. But specifically, I want to set the stage of why health equity matters. For us at the National Bleeding Disorders Foundation, it's specifically tied into our mission. So it's mission driven and it's Lee centered. And you say, well, what's a Lee? Here in the US, we refer to them as lived experience experts because affected persons, people who actually have the blood disorder or bleeding disorder or disease, are the people with the expertise, right? We have doctors, of course, we have other healthcare providers, we have persons like myself who all work in the area, but the actual experts are the people who live with this every day. No one knows your condition better than you, right? So for us, it's mission driven because at the National Bleeding Disorders Foundation, we have dedicated ourselves to finding cures for inheritable blood and bleeding disorders. And we address that through education, research, and advocacy. But what's most important is what I want you to focus on at the very end of our mission statement, enabling people and families to thrive. How can you thrive when things are not equitable, when care is not equal, when you're having issues with being diagnosed, or you're having issues with your physician or hematologist, not fully understanding the cultural aspects of who you are? Next slide, please. So what I want to talk about next is the landscape overall. And the landscape is just looking at disparities across all inherited blood disorders, right? And this landscape is looking at the fact that we all have in common issues where there are delayed or misdiagnoses, right? Where maybe the provider isn't aware and has limited access to specialized testing, right? We're looking at limited treatment access for those underserved communities, for those who lack insurance coverage, or even proximity to hematology centers or a hematologist overall. Also looking at it, there are poor health outcomes, which can be linked to socioeconomic status, race, gender, geographic isolation, or living in areas that are very rural. In addition to mental health outcomes, that's a huge consideration here, where we're looking at the emotional turmoil that people deal with treatments and their capacity of their family members to handle the economic burden of those treatments. Again, in certain instances where there are transfusion dependents, the frequency of those transfusions may pose transportation burden, loss of days at work, and lost productivity. So, all of these things combined with a lack of adult care infrastructure, mostly in sickle cell interventions, they focus on women and children, or infants and children, I'm sorry. And with that, then you don't have an infrastructure that fully supports the adults who are affected. And so this is the landscape for what we're looking at. So just setting the stage for where we're about to go. Next slide, please.
Just giving you a time check. We have about in your presentation.
I'm going to speed through this. Thank you.
Perfect.
So here I've given an overview of sickle cell disease, PKD, and PNH, and then looking at it across prevalence, diagnosis challenges, treatment access, health outcomes, and socioeconomic disparities in advocacy and policy, we see that there's some commonality that kind of flows across all three areas. And these are the same commonalities that we see with hemophilia and also with other rare blood disorders. So with that, we honed in and began looking at what needs to come together. Next slide, please. This is our framework that we have proposed, and we have a paper. It's entitled From Vision to Action. And the authors are myself, Dr. Lane Valentino, my team members, and Dawn Rodolini, who's the COO at NBDF. And we came up with this framework that encompasses looking at priority populations, where we want to focus, those strategic approaches that we've named, and there are 10 of them, and then going down this roadway that leads us to health equity. Well, we have to break down those silos. We have to address those social determinants of health that have become barriers to care and barriers to access, barriers to diagnosis, barriers to treatment, and mostly barriers to health equity. And so what you see are there's a role for everyone here, individuals, communities, organizations, and institutions. And each person with their role has to continue to knock down those social determinants or social drivers of health. Next slide. So as we began to understand health equity through the vision or the lens of inherited blood diseases, then we have to look at how we're defining health equity across the spectrum, making sure that we're all defining it the same, right? Looking at disparities in care specifically for those marginalized communities and looking at limited access to treatment, poor health outcomes, and then taking this vision to action framework and encompassing it so that we can recognize where the inequities are and implement a systemic healthcare trajectory for everyone in the community globally. Next slide, please. So you say to me, well, Dr. Norris, what are these strategic approaches? And what's this E3 model? And so the E3 model is a large part of the framework that focuses on engagement, empowerment, and elevation. And that engagement needs the community present, needs those leads, and encompasses education and leadership to operationalize equity and move it forward to create this systemic change that we need. And so in this framework, we give a blueprint for how to address those things. Again, where everyone has the ability to interact. Next slide. So there are layers to the E3, right? We're looking at those circumstances of daily life that have a direct influence on health outcomes, and then those indirect circumstances of life that also influence health outcomes. But what you will see is that everyone has the ability to work on health equity at the individual level, which includes yourself and family members and caregivers, community members, which includes in the US, we have various chapters throughout the country, throughout the world, and other countries. We will see that there are pockets of organizations and pockets of communities that focus on advocacy and moving the needle forward in regards to health equity. Then you have organizations, and then you also have institutions, which are usually those government institutions that fund or do research. Everyone has a role. Everyone has the ability to impact these healthcare outcomes and to create equity. Next slide. Here you'll see the actual strategic approaches that we've created over the next 10 years of how organizations, individuals, institutions, and communities can interact with these things. And so I won't go into detail, but if you read the article, then you'll see some insights into how to use these strategic approaches, or feel free to reach out to me. Next slide. So what we want to look at here are, how do we adapt this, right? We look at our common challenges. We build trust in the community through using the E3 model and saying, hey, I'm going to take on my role and do what I need to do. We tailor those social determinants of health. And then we also do cross-disease coalition building. That's what's important. Last slide. So Building the Future Forward looks at national and international coalition formations using the community voices be very inclusive of those leads and the realities of those who are affected by bleeding and blood disorders. We look at collaborative roles through funders, researchers, clinicians, and advocates. And then we build a platform for innovation, which includes this national and international coalition to move health equity forward. Thank you so much. And I will take questions now.
Beautiful. Thank you for keeping to time both effectively and efficiently, Dr. Norris. As she mentioned so eloquently, this is the opportune time for folks to submit any questions. My colleague, Mr. Tunji-Ajayi, will also launch a poll for folks to submit their feedback about the plenary or the keynote. So at this moment, if you have any questions, please feel free to enter them either via the chat or using the question and answer feature. I do see one question in the chat, Dr. Norris. It says, if we say we're on a pathway to health equity, how should that progress be measured and by who? What role should patients or community organizations have in shaping these metrics?
Wow, that's a great question.
Indeed.
So the first thing that I would say specifically, sorry, I have to close something out. The first thing that I would say specifically is you have to determine what your capacity is. Everyone won't start at the same capacity level. You work with what you have to build capacity and to then leverage partnerships to grow in, because one person, one individual can do things in their own lives to advocate and move things forward, but there's power in numbers, there's strength in coalition building, there's strength in partnerships. And this conference is one way that we're getting together to create community around discussions, to build coalitions, to work internationally. And it's my hope that we'll continue moving and charting that path forward. So I would say for advocates, for clinicians, for researchers, wherever you fall on the spectrum of a person within this community, that you decide where you want to interact and intervene and who you want to partner with and where you can most leverage your own power and then leverage those partnerships.
Masterful. Okay, I'm not seeing any other questions at the moment. Maybe I can ask one selfishly, Dr. Norris. In terms of barriers or hurdles folks should be wary or be prepared to come up against when trying to grow those numbers and trying to make change, is there any advice you can give to folks online?
Yes. So I would say the largest thing is systemic issues, right? So we all are well aware that across the globe, there is a block with oppression, discrimination, and lack of access. So within those things, you're going to continue to face these barriers. But again, in numbers, with advocacy, through education, and through policy change, we can make a difference in that. And all three of those actually tie in together. So you're looking at how you're going to specifically advocate for your community, how you're going to use those partnerships to gather people to effectively make policy change. And then within that, then you're moving the needle forward, whether it's incrementally, whether you're going by miles, whether you're like at the speed of lightning. However you're doing it, don't stop doing it, because you're going to face these things. And one last thing, another barrier to consider is cultural humility. We talk a lot about cultural competence, but can you really be competent in someone else's culture? Okay, so that's one thing. But cultural humility says that I recognize that I don't know everything about this other group. And I am not in my ego in treating this patient. I am not in my ego in creating policy. And I'm not in my ego in advocating for others. So I am going to humble myself enough to learn about what's going on with them, what their family structure is like, what type of, literacy do they have? Am I speaking to them in their native language, or am I expecting them to do what I need? You have to speak English to me. So there's a lot that needs to happen there between the provider and the patient, and between social workers and patients, and also through folks who make policy and patients and caregivers and families. And so once we start addressing that and that underlying issue with cultural humility, which is unconscious bias and prejudice, and sometimes racism and xenophobia, when we address those things and we're honest enough with ourselves, then we can move that forward.
Powerful. I mean, if this is any testament to the rest of today, I think you've started today off with a bang. Dr. Norris, thank you for your insight. Thank you for sharing your wisdom. It was a great privilege to even hear that response in and of itself. So with that, folks, if you could join me, continue throwing in those hearts and those claps for Dr. Norris in a fantastic plenary session. Our keynote address, following the plenary that follows will be led by Dr. Julie Cantor and Dr. Sarah Patterson about the future of gene therapy and inherited blood disorders. I'm looking forward to being a participant in the remaining sessions of today, and I hope you all too. So with that, that draws a close to our keynote address by the one and only Dr. Keri Norris. Thank you again.
Thank you, and thank you for having me.
Likewise.